public schools.
Well, we'll link to that at democracynow.org.
Well, President Obama is holding a bipartisan summit on health care today as he tries to keep his overhaul effort alive. The talks are expected to stretch on for 6 hours and will be televised on C-SPAN. The White House has invited 22 high-ranking lawmakers to the meeting at Blair House, across the street from the White House. The 4 topics on the agenda are revamping insurance, cost containment, expanding coverage, and the impact of health care legislation on deficit reduction. The Obama administration is holding the summit amid renewed criticism over its refusal to push for a public option under health care reform. President Obama omitted the public option from a health care proposal unveiled this week. On Tuesday, White House Press Secretary Robert Gibbs said there isn't enough political support to pass a public option through Congress.
We have seen, obviously, and I talked about this some yesterday, that though there are some that are supportive of this, there isn't enough political support in a majority to get this through. The president took the Senate bill as the base and looks forward to discussing consensus ideas on Thursday.
23 Democratic senators have publicly signed on to supporting a public option, and the White House has been criticized for not attempting to secure the 50 votes needed for simple majority approval through budget reconciliation. Meanwhile, Republicans are criticizing Democrats for looking to pass the bill through reconciliation to bypass their efforts to filibuster. Speaking on Fox News, South Carolina Senator Lindsey Graham said it marked the end of minority rights.
At the end of the day, I want health care reform, but I want a Senate that works and slows down bad ideas and sometimes, unfortunately, good ideas. This will be the end of the minority rights in the Senate as we know it, and the casualty of this whole debate would be the loss of the United States Senate as a real viable institution. It will become the House, and no bill is worth that.
For more on the health care debate in Washington, D.C., we're joined right here in our New York studio by Glenn Greenwald, constitutional law attorney and political and legal blogger for Salon.com, author of 3 books, his most recent, Great American Hypocrites, Toppling the Big Myths of Republican Politics. Welcome to Democracy Now!, Glenn.
Great to be here.
Can you respond first to Senator Lindsey Graham?
Well, the idea that reconciliation is some sort of unique or exotic instrument in the Senate is just so blatantly false, and it's not really hard to see why that's so. Reconciliation is nothing more than a long-standing Senate rule that allows for certain measures to pass with 51 votes and can bypass the filibuster. The Republicans have used reconciliation repeatedly when they were in the majority. In fact, Judge Gregg in 2005 went to the floor of the Senate and gave a vigorous speech attacking Democrats for the suggestion that there was something inappropriate about it. He said it was just a standard rule of the Senate. It's nothing more than majority rule. Many health care provisions in the past have been enacted through reconciliation, including COBRA and the Children's Health Insurance Program. So the idea that there's something anti-democratic about passing a bill with the support of 51 elected senators is extraordinarily Orwellian. In the case of the Republicans, criticism is incredibly hypocritical.
But the argument that obviously the health care legislation is such a huge piece of legislation and involves such a fundamental change in the way that the government provides services to the people, what about that argument that reconciliation should not be used?
Well, I think there have been other examples in the past. As I said, COBRA was an extraordinarily significant change to the way in which we provide health care coverage, requiring employers to allow continuing coverage after employees leave or are fired. Certainly the Children's Health Insurance Program drastically expanded health care coverage. In the United States, there have been enormous tax cuts for the wealthy under the Bush administration that didn't have 60 votes but had 50 votes and were done through reconciliation and extraordinary transfer of wealth in this country. So there's no magnitude test or any other size requirement invented now by the Republicans and by some Democrats to justify avoiding reconciliation in order to bring real reform.
Talk about President Obama and the public option.
Well, to me, the way in which the Democrats have conducted themselves concerning the public option is really quite amazing. Not because of what they've done, but because of how blatant they're being about it. The public option, of course, all along was already a compromise from what most progressives wanted, who wanted single payer, and were told by most Democratic politicians for a long time that single payer was the optimal course. The public option was already a means of doing nothing other than at least providing some competition to the private health insurance industry. And all year long, Democratic senators and the White House pretended that they were in favor of the public option. They kept insisting, we're behind the public option, we want the public option, even though there was all sorts of evidence that the White House was secretly negotiating with the health insurance industry to make sure that it would be excluded from the final bill.
What kind of evidence?
Well, the fact that senators ended up saying that in private meetings with the White House, it was made clear to them that the public option was not something that was a priority for the White House, and that they would end up happy to see it gone. Health insurance lobbyists were coming in and out of the White House. And the reason they didn't end up vigorously opposing health care reform was because there would be no competition for the private health insurance industry in the form of the public option. And of course, the final bill didn't have a public option, and the White House did nothing to support it. But what's most incredible is that the excuse that they gave to the progressives was that the reason that we couldn't have a public option was because there were 50 Democratic senators, or 51 Democratic senators, who supported it, but there weren't 60. And because of the filibuster rule, sadly, the public option just couldn't get into the bill, and there was just nothing the White House could do, as much as the president wanted that to happen. Well, now you have a situation where everybody is talking about doing health care reform through reconciliation, where only 50 votes, not 60 votes, are required. And what does the president do? He immediately, when he finally unveils his first bill, excludes the public option from the bill, even as he says we're going to use a process that will only require 50 votes. And you even saw Senator Jay Rockefeller, who spent the year pretending to be so devoted to the public option that he said he will not relent in ensuring that it gets passed, that there is no health care reform without a public option. Now that it can actually pass and become a reality, he turns around and says, I'm not inclined to vote for it.